Let's get straight into your questions now. Joining me tonight to answer those questions is Dr. Deepti Gurdasani, who's a clinical epidemiologist and senior lecturer at Queen Mary University of London, William Harvey Research Institute. Next to her, we have Professor Azeem Majid, Professor of Primary Care and Public Health and Head of the Department of Primary Care and Public Health at Imperial College London. And then we have Professor Robert Reid, a member of the Joint Committee for Vaccines and Immunisation and Professor of Infectious Diseases at the University of Southampton. Thank you very much to all three of you for being with us tonight and for answering our audience's questions at a time when I know we need as much information as we can get. The first question comes from Debbie, who's voicing, I think, a lot of the COVID fatigue all of us are feeling. What will it take to put an end to all these restrictions and the daily figures and tests? Everyone being vaccinated? Herd immunity? Will there ever be an end? I'd like to start with Professor Robert Reid from the JCVI on that one.
Well, good evening. And, well, what will put an end to it? I'm afraid it's time, actually. This is a highly agile coronavirus. We are expecting it to be with us for the foreseeable future, if not perhaps a few years, if not more. What will put an end to it will be more and more people having experienced natural infection and being vaccinated. And as the years roll by, we'll probably see a situation where we're just needing to provide booster vaccinations to certain sectors of the population, particularly the elderly, possibly on an annual basis. But eventually what will put an end to it is time. And I can foresee a time when we'll see the back of the dangerous aspects of this virus.
Just very quickly, you say time. Any idea of how much time?
I wish I knew that. I wish I knew that. But I'm expecting this to be a recurring problem for 2 or 3 years.
OK. Dr. Deepti Gurdasani, you're an epidemiologist. We know that the threshold for herd immunity depends on every disease and how it's transmitted. And obviously, we're still learning about COVID and its variants. Are we closer to understanding where the level of herd immunity, whether that's through vaccinations or through having had the disease, where that level of herd immunity might be for COVID?
So, I mean, I'm going to first start by disagreeing with Prof. Reid. Living with the virus is a recipe for forever COVID. This is a virus that's rapidly mutating to become potentially more transmissible, potentially more severe, more able to escape vaccines. And there's no guarantee that that won't keep on happening. In fact, every 3 to 6 months, you've seen a new variant replace the previous variant and cause devastating waves with a lot of deaths and a lot of long COVID. So herd immunity may not even be possible to reach with this virus simply because by the time you have enough, a particular number vaccinated or boosted, you have a new variant that arises that escapes previous immunity really, really well. In fact, in 20 months of this pandemic, no country to date has attained herd immunity. And I think the mistake that I have seen in terms of public messaging has been that vaccines are the panacea that will end this and herd immunity is a panacea that will end this, when actually it's layered mitigations, with vaccines being one of several mitigations that are used over a period of time, and global movement towards suppressing the virus rather than living with it, which will lead us out of this.
Interesting you talked there about vaccines not being the whole picture. Of course, restrictions, lockdowns could be another part of that picture. Our second question from you at home is, are we locking down to protect those who have not been vaccinated? Professor Azeem Majid, I'd like to come to you on that.
Hello. So the measures we've introduced are for the whole population, not just those who are vaccinated. Clearly, those who haven't been vaccinated are at greatest risk of illness, of infection and serious illness. But the measures protect everyone because even those who are vaccinated, if there's high case numbers, some of those people will get infected. And of those, some will have unfortunately serious illness that will lead to admission to hospital or death. So these measures are for everyone and not just being vaccinated.
OK. Professor Robert Reid, there's a sort of other question hidden in that question. Are we locking down to protect those who've not been vaccinated? How do we get those people who have not been vaccinated to get vaccinated? How important is it that they are vaccinated?
Oh, it's extremely important, and I would agree with your other guest. Actually, the restrictions being imposed at the moment will protect people who have been vaccinated, because even though I'm a great exponent of vaccines, the efficacy, the protection you get from it is 90% or thereabouts, and across the entire population, that means that you're not going to protect absolutely everybody with the vaccines. There are always going to be some people who are vulnerable to the infection and to disease. So how do we persuade people who have not come forward for vaccination? And unfortunately, there are still a lot of those people, millions. And all we can do is provide them with the evidence that vaccines work and are very safe. We've already shown that this country's vaccination program has saved many lives. And if you haven't been vaccinated and you're watching this program, if you get yourself vaccinated now, you will reduce your chances of severe disease from this infection. And you can be sure that this infection is coming your way, because this is a highly transmittable virus, and we are going to see more infections in this country very soon. So please go and get vaccinated if you haven't done so already.
Okay, a message there for our audience, and we have here a school child asking from our audience, saying, as a school child myself, will schools close again? Now, I'm not sure. I mean, short of asking a government advisor on that, it's very hard for us to predict that. But let's give it a go in any case. Professor Azeem Majid, let's begin with you. Do you think it's possible that schools would close again? Obviously, millions of children worried about that, their education already damaged because of last lockdowns. Is that something you think might happen again, or do you think everything's being done to avoid that?
It's possible, but it's something I hope we can avoid, because clearly we saw damage that was done before by school closures to children and their education. So I think through measures we can mitigate the infection in schools, so ensure that all staff are vaccinated, including with boosters, ensuring we have good air quality in schools, including good ventilation, that we do test people appropriately when there are symptoms of infection, and we deal with outbreaks of infection very promptly. So I think through measures like that, we can mitigate the effects of the virus in schools and keep schools open. I think closing schools should be a very, very last resort for our society, because of the damage that causes. I think face masks also have a role to play in schools, for older children in particular. So I think through a combination of measures, we can keep the virus suppressed within schools and hopefully avoid school closures. But we have unfortunately seen high case rates in schools since September, when schools reopened across England. But hopefully...
Sorry to interrupt you there. We're going to stay with mask wearing, because our next question is, should exemptions have to be proven for non-mask wearers, as too many people are abusing the exemption excuse? Let's start, Dr. Deepti Gurdasani, I'd like to come to you on this, I guess with a question really about, first of all, how effective masks are against the spread of COVID, and then whether that would actually warrant this idea of some sort of punishment for people who are abusing those non-mask wearing rules.
So mask wearing is highly effective, but it depends on how many people are wearing the mask and the quality of the mask. So we know, for example, areas that have had mask mandates, and even in schools where mask wearing has been present, infection rates and outbreaks have been very low. And high quality masks like FFP2, FFP3 masks can be very, very protective, not just for other people, but also for the wearer. In terms of penalizing people or asking them for proof of exemptions, I don't think that's necessary. I think what you need is really, really good public messaging, which I think has been found really wanting from this government. I mean, the government has conflated mask wearing with restrictions, when masks actually allow you to be freer because they reduce the community rate and allow you to move outside and actually socialize with people in a safer way. And the fact that our own Prime Minister has been caught out on many occasions not wearing masks, where our government has recommended mask wearing, itself is poor role modeling. And I think those are the issues we really, really need to fix before considering penalizing people and asking them to provide proof for exemptions.
OK, thank you. A lot of people trying to second-guess the government's Plan B and what they're doing and why they're doing it. This question now, is the government bringing in half-hearted measures now to go over the Christmas period, with expected lockdowns to come by the middle of January? So the idea that we try and have these sort of small measures now in order to try and hopefully get us through Christmas, and then we'll see what happens after Christmas, because we can go into lockdown if we need to. Let's start. Professor Azeem Azim Majid, of course, I'm not asking you to try and look into the government's minds when they're trying to make these decisions, but from a public health perspective, is there an argument that says actually protecting Christmas, protecting people's mental health and their socialisation over that Christmas period, allowing them to try and have a semblance of a Christmas is very, very important, and let's see where that leaves us in January?
No, that is very important. I think at the moment we're facing a virus that we don't fully understand. So this new variant is new and we don't fully understand how it will behave in the next few weeks. So I think hopefully over the next few weeks, we'll have more data on how effective it is, how serious the infection it is that it causes, and how well it evades vaccines. I think once that data comes through, we can then plan more effectively for the future. So hopefully we'll have positive news on those messages. I'm very hopeful that 3 vaccines will hold the line against this variant. And if that's the case, we can hopefully have a better new year as we push our booster program in our population over the next few weeks.
It's interesting because when obviously the government's looking at data, some of which we're able to see and some of which we're of course not able to see. Chris Whitty showed a graph recently that was showing hospitalisation numbers. We've had Sage recently saying the Omicron-based hospital admissions alone could be in the order of 1,000 per day by the end of this year. Chris Whitty there showing, and you can see it on your screens there, a graph that shows that the number of hospitalisations had started to decline at the beginning of December. Chris Whitty saying he's expecting that to start rising again in the next couple of weeks as we go into this Omicron phase, this Omicron period. Dr. Deepti Gurdasani, do you think, looking at that data, that we ought to be getting ahead of this disease rather than responding to it once we already see the curve starting to go up?
Absolutely. And, you know, hospitalizations are already going up quite sharply in the Southeast. So it's only a matter of time that they'll be going up everywhere else as well. And actually, the SAGE documents make this very, very clear that if you act late when hospitalizations are already high, you really have missed the opportunity because health systems will very likely get overwhelmed by that point. You have to act early. I mean, this is a virus that's doubling every 3 days. It's causing high levels of hospitalizations that are doubling, more than doubling in Gauteng province. So we have to learn from that. Even if we think that this may be less severe or that boosters may be effective, just the sheer number of people who get infected could lead to very, very high pressure on our health systems. In fact, we're talking about the end of December here, but the SAGE documents say that the best case scenario is that there will be between 1,000 to 2,000 admissions daily in January, and they're saying that it could actually exceed previous peaks. So we need to act aggressively and early and scale down rather than acting incrementally as we are right now.
Professor Robert Reid, I want to get your thought very, very quickly on this because we do have to move on to the next question, but this is crucial for Christmas. Where do you stand on the Christmas versus COVID measures argument there?
Well, I do think we need to slow this virus down, but also we have to have a sense of proportion. I agree with the government's position. I don't give them advice on this. I give them advice on vaccines. But what this virus is going to do is peak by late February, early March in terms of infections. We simply do not actually know whether the UK is going to yet suffer vastly increased hospitalizations. That information won't start to become apparent for at least 1 or 2 weeks. So it's a little bit early to say. You see, what you're asking us to say is, should the government lock down completely now? And that would certainly stop the variants transmission very, very effectively. Not absolutely, but the measures that have been taken so far will contribute to slowing it down and giving us a chance to get boosters into arms, which is going to be key.
OK, the next question. The new variant appears to be more transmissible. In view of this, shouldn't the government be preparing the Nightingale hospitals? Professor Azim Majid, let's start with you on that. Should the Nightingales be reopened?
No, I don't think so. I think we need to invest in our current hospitals and our current infrastructure. So invest in COVID hubs in the community, which will assess patients and perhaps deliver the new antivirals that are being promised for the future. Invest in A&E departments, in hospital wards, in IC units, in our current hospitals. Last year, we did invest heavily in these hospitals, these new hospitals, but they were barely used across the country. So that money really wasn't a very cost-effective use of our taxpayers' resources. So I'd rather see the money going to supporting our current infrastructure in the NHS, whether that's in the community or in our current hospitals, rather than building new hospitals.
And there's another part to that question, which is essentially saying, pointing at the fact that the Omicron variant is supposed to be more transmissible from what we know about it thus far. We still don't know how severe the Omicron variant is compared to, for example, the Delta variant. Dr. Deepti Gurdasani, do you have any more information? I know there's data coming out of South Africa at the moment, but what are your thoughts on that, the severity of those two variants compared to each other?
So the data coming out of South Africa is very mixed. And what it actually shows is hospitalizations are doubling or more than doubling every week. But the severity indices among people hospitalized in the older age groups are lower, while in the younger age groups, they're higher. So overall, less people are, for example, requiring oxygen. But it's also that a younger cohort is being hospitalized. So part of this could be that there are younger people being affected initially because transmission is usually initially among young people, or that vaccines are having an effect in the older population as they should. But what we do know is that it is spreading really, really quickly. And ultimately, if you look at population impact, even if this variant is less severe than Delta, the rate of rise in the sheer number of people impacted will overwhelm healthcare systems regardless of the severity. And that's what SAGE modeling is also telling us. So it's very, very important to actually prevent people getting to hospitals by preventing them getting infected. Because hospital capacity is finite and can only be increased so much given the limited staff that we have and that our healthcare force is already devastated. So prevention is vitally important for a very, very rapidly spreading virus such as this.
OK, thank you. The next question, if I have a positive PCR, how do I know which variant I am positive for? So this is into the PCR tests and how specific they can be about the different variants. Let's start. Professor Robert Reid, where are we at with that? How long would it take for every PCR to be screened for which variant it is?
I'm not sure whether the public are yet given the information about whether they've got what's called an S gene dropout. But
I can tell you we're not. I can tell you we're not because I had a PCR on Monday, which was negative, and I was at the time when I was asking there, they said no, they're not telling us on the NHS. They're not yet telling which strain we would have.
Yeah. Yes, I mean, it goes to a central lab and it's verified and the information is used by epidemiologists, which is critically important. For the general public, actually, I'm not sure that it makes any difference at all whether you're infected with Delta or Omicron, because as far as we know at the moment, although Omicron is almost certainly more transmissible, there's no evidence that it causes more severe or less severe disease even. So actually for members of the public, it's not a relevant question. Once you're infected with COVID-19, that's the information you need. So I'm not sure that the question is pertinent.
OK. I guess I wonder if the first that you would hear of having Omicron, if you did have it, was the follow-up phone calls that might happen if you did have it versus the Delta, because they're obviously tracking Omicron in a way that they're not Delta. As a follow-up to that question, vaccine efficacy on Omicron, we know that vaccine efficacy on Omicron is still making people less severely ill if they do catch Omicron. Do we have any sense of how vaccines are faring compared, Omicron compared to Delta, how much they'll fight those two variants, Professor Reid?
We don't have confirmed information yet. It's still a little bit early. The really important thing, aside from laboratory information, is the clinical epidemiology. The laboratory information is not yet complete. We should know fairly soon whether or not the blood of vaccinated people is highly effective against Omicron or not. And if there is a reduction in neutralization capacity, just how much that reduction is, because when we know that, we will have an opportunity to make firmer predictions. We won't really know about whether the current vaccine program has blunted likelihood of Omicron disease for 1 or 2 weeks. So it's still a little bit early, I have to say.
OK. Professor Azeem Majid, do you have any thoughts on that idea of PCRs? How do I know which variant I've tested positive for?
So people aren't told normally what type they had. If they are infected, you're told if it's positive or negative, your test result. Currently, most infections are due to Delta, so if you are infected, it's probably Delta, although that could change in coming weeks if the Omicron variant increases still further. But I agree with Professor Reid that people need to know they're positive or negative. The actual variant doesn't really matter that much because it doesn't really affect your clinical management, what variant you've got at the moment.
OK. Right, our final question. Taking the latest government rules into account on theatre and cinemas, why is it deemed safer to go into a packed pub or a restaurant than a theatre or a cinema? Let's start with Dr Deepti Gurdasani on that. Does the virus care whether you're in a theatre or a cinema or a pub or a restaurant? Is there any logic to that, do you think?
No, I mean, you'd have to ask government that question because the virus is airborne and airborne spread happens in all, particularly indoor crowded environments where people gather. And those are exactly where super spreading happens. So I think any scientist or physicist would struggle to explain government policy in that regard.
OK. Professor Azeem Majid, presumably part of the thinking there is that you have to take your mask off if you're in a pub or a restaurant to drink and eat. Therefore, if it's going to be off, it might as well be off the whole time. Whereas in a theatre or a cinema, it's much more feasible to carry on doing that activity with the mask on.
That's correct. In a pub, clearly you can't with the mask on all the time because you have to eat and drink. So either you close pubs or you allow people to take their masks off. But it is the case that pubs are potentially quite risky environments because people are crowded together closely. Often the ventilation is quite poor. They're talking loudly, so expelling more air and more virus. Some advice is if you are vulnerable clinically to perhaps avoid pubs in the next few weeks until we know more about this variant and how it spreads.
OK, that's very interesting that, that you're saying potentially might be worth thinking about avoiding pubs there, because I'm sure lots of people watching will want that sort of advice. Very finally, really, really quickly, Professor Robert Reid, just for the final word on this, do you think when we look at the way that the advice has gone, the fact that working from home is suggested, but, you can carry on going to quite a lot of social gatherings, do you think the government is prioritising our mental health in this period over perhaps a sensible approach to try to contain the virus? And is that important?
It absolutely is important. I think the government is taking all sorts of advice from all sorts of places, and it's trying to balance the need to reduce as much as possible the rate of progress of this virus through our population with their mental health and with the economy and with people's wider health. So I think it's an extremely complex problem to which there's no simple answer.
All right, well, thank you very much. I'm not sure that's cleared it up for us, but certainly thank you so much to our panel here tonight. Professor Robert Reid from the JCVI. Next to him, Professor Azeem Majid, Professor of Primary Care and Public Health, and Dr Deepti Gurdasani, who's a clinical epidemiologist. Thank you to you all for answering those questions.